Okay. We'll just give it a little bit of time as people trickle in. Okay. All right. Okay, everybody. So thank you for joining us this evening. We haven't had a PEP in a few months, and so we're very excited to be back in our PEP seat. So we have a great event tonight. It is going to be on May-Thurner Syndrome. The title is What You Need to Know About MTS. So welcome to our event. I'd like to introduce our guests. First, we have Sarah Lemire, who is a lifestyle reporter at today.com. And she is an MTS patient. She's going to be sharing her incredible story with all of us tonight, and it's going to be put into the chat function. So everybody can grab it and read it directly. So Sarah, thank you for sharing that with us. And then we have Dr. Suresh Vedantham, who is a professor of radiology and of surgery at the Washington University School of Medicine in St. Louis. He is an interventional radiologist. He specializes in the delivery and evaluation of image-guided therapies for venous disease, including venous blood clots. In his clinical practice, he sees patients with very complex venous disorders who are referred to him across the country for treatment, and that often includes innovative image-guided procedures. Suresh did his fellowship in interventional radiology at Stanford, his residency in diagnostic radiology at University of California, Los Angeles, his medical degree from the University of Chicago Pritzker School of Medicine, and his undergraduate degree from Northwestern University. So thank you both very much for joining us this evening. And before we get started, Todd is actually going to kick us off with some poll questions. So Todd, off to you.
Yeah, so our viewers out there and people are listening in, you know how some of you know how this works. We've got some poll questions for you. They're up on your screen if you could just answer them. The first question is, what is your connection to May-Thurner Syndrome? The options are, I am a DVT PE survivor seeking information on MTS. I have MTS. I am a caregiver for someone with MTS, or other. Our second question, what is your knowledge on MTS? No knowledge, some knowledge, very knowledgeable. And our third and final question for our kickoff here is, what is your knowledge about the signs and symptoms of blood clots? That would be no knowledge at all, some knowledge, or very knowledgeable. And then we'll go ahead and just read the results here real quick when they pop up. And there we go. You guys should be able to see this. What is your connection to May-Thurner Syndrome? 53%. I am a DVT PE survivor seeking information. I think that represents a lot of us. We want to know more about this, and we're going to find out more tonight. 35%, I have MTS. 6%, I am a caregiver for someone with MTS, and 18% marked other. What is your knowledge on MTS? 35%, no knowledge at all. That's not a surprise. 59%, some knowledge, and 6% very knowledgeable. So we have a couple of people out there that know a lot about it. What is your knowledge about the signs and symptoms of blood clots? No knowledge, 0%. Some knowledge, 53%, very knowledgeable. We kind of expect this, 47%. So thank you for doing that poll. We're going to have one at the closing, at the end of the show also. So please participate in that one. I want to thank everybody out there for attending. It has been a couple of months, I guess. Doesn't seem like it's been that long, Leslie, but we've missed doing this. We love doing pep talks. They're so informative. And tonight we are going to be discussing May-Thurner. I know that I don't know enough about MTS, and I'm looking forward to, containing some knowledge moving forward. So when I talk with patients in the support group, I'm able to converse with them a little bit better. But Suresh, I want to go ahead and start with you, and let's just start at the very top. Can you explain what May-Thurner syndrome is, what it is, And does it disrupt blood flow? How does it disrupt blood flow? What is MTS, Suresh?
Well, so thanks very much for having me here. Really a pleasure to just interact with this group, first of all. And May-Thurner syndrome, is a term that gets kind of thrown around a little bit and can be confusing. But the other term for it is kind of what's called iliac vein compression syndrome. And so I'm going to try and share a diagram with you, and we'll see if it works. And if so, that may be helpful. Can you see that picture?
Yes, perfectly.
Yes.
Okay, I know it's like the last thing y'all wanted to look at at dinner time. But in any case, so if you can just imagine the top of the screen is kind of more or less behind your belly button. You have a vein, this left vein here that comes up on, it's probably on the right side of your screen, but it's the left-sided blue vein, and it's got labels on it, words on it. And that's what's called your iliac vein. It drains the blood from your left leg, basically. And it's up in the pelvis. And as you can see near the top of the screen, where the aorta, the red aorta here branches into two branches, you can see it crossed the very top of that iliac vein. And right in that area, probably because of the irritation of the pulsation of that artery, and also oftentimes they both sit right on top of the spine there. And it may be that the artery just kind of pounds on the vein against that spine there. Some people, and we don't necessarily know why, develop irritation of the vein that eventually becomes narrowing of the vein, or webs inside the vein, or something that kind of changes, the vein that can slow the blood flow through that area. And so then that becomes one factor. And then when a patient has other factors that make them more prone to clot, then they can develop a blood clot or a DVT on that side. And typically it will be a large DVT that involves that iliac vein and then also the veins down into the leg. And so when someone comes in with a new blood clot that's involving that left iliac vein down into the leg, one of the things to consider would be the possibility that there could be an underlying narrowing in the vein, or what we call May-Thurner syndrome. Now, that's the classic May-Thurner. The other things to consider are that there are patients that have that narrowing. In fact, lots of people have that narrowing without forming blood clots. And some people don't have symptoms in their leg because of it, but others do. And so sometimes people also get labeled as May-Thurner syndrome if they have a narrowing in the vein and they have symptoms, even if they haven't clotted. And then finally, the third aspect is that many people who develop a new blood clot with their May-Thurner syndrome, they clot off the vein, and people don't necessarily know about it at the time. They get treated with blood thinning drugs like usual. And then down the road, they continue to have leg swelling, aching, symptoms in their leg. And it's discovered that that vein has been blocked kind of for a long time, right? And then sometimes they get the label of May-Thurner syndrome. It probably was a May-Thurner syndrome in many cases, but you'll hear the term thrown around for these different situations. And for a patient, I can imagine it could be a little bit confusing as to what's being talked about. And when they read about it and hear others talk about it, their experience might not quite match someone else's that's talking about the same thing, really.
Suresh, are certain people more inclined to get this, more women, or is there anything, are people genetically predisposed to it at all? Or, who's getting this? Who has this syndrome?
It can occur in anyone, but, there does seem to be a bit more common in women, and it's in particular more often, but not always, in thinner women. And it could be just because of the amount of space that's in there. You've got the spine there and then you've got the artery, but we don't necessarily totally understand that. And the truth is that, we see that narrowing in all kinds of people, really, so it's not really limited to one group necessarily.
Interesting. I did read something that said that pregnant women are at higher incidence of getting MTS. Is that true?
Well, pregnant women have, just by being pregnant, they're more prone to clotting. And of course, they've got just both the biological effects of the pregnancy and just the pressure, right, from the fetus and on the vein. And so, yes, they are. And if they have a narrowing in the vein as well, that can certainly be another factor. And so the answer to that would be yes.
Interesting.
Can
Okay.
you tell us how that's diagnosed, Suresh?
Well, so this is the challenging part, is that vein is way up in the pelvis and abdomen, really, right? And so when someone, even when they come in with a blood clot of the leg, they generally get an ultrasound exam of the leg. And people will diagnose the blood clot often, but they don't necessarily go looking for that narrowing, and that can be an issue, the treatment of blood clots really is mainly blood thinning drugs, but if there's a narrowing up there, that can potentially be a reason why someone might be more prone to new clotting episodes. And so if someone comes in with a left iliofemoral clot, it is, I think, in many situations, a good idea to evaluate that. And the ways that you could do that is either with a CAT scan or a venogram, where someone puts a catheter inside the vein and looks, So I think that there are different ways to evaluate for it, but I think it should be probably done more often. I don't think everyone needs to have it assessed, but certainly if the people come in with that suspicious distribution of clot, then that should trigger some thinking to go looking.
No, thank you.
So you've been doing this for a while. Have you started to see more patients get diagnosed with this? Like, how big of a patient universe is this?
Yeah, so it's not totally easy to tell. We know, as you know well, that maybe there's around, in terms of new first-time blood clotting episodes in the US, maybe 300,000 patients a year present or hospitalized or identified for care. Of those, maybe around, probably around 10 or 20% involve the iliac vein. And then some of those, will have a narrowing, So it's hard to know how much, and some of that is that we don't always diagnose that narrowing, and the connection to the blood clotting is not always clear. But, it's certainly in the patients, we know that when we go in and dissolve clots by doing image-guided procedures, that narrowing is there about half the time. Now, the people we dissolve them in are people who have pretty bad symptoms typically, right? So it's kind of a selected group. So if you ask me to guess, I would probably say 50,000 or so, or maybe not 50,000, 10 to 50,000, somewhere in that range probably is more.
Wow.
Yeah.
It's actually a lot.
It's a lot, it's not, but remember that the tough part is that there are some people that have a very tight narrowing of the vein, and the history is very clear and the distribution is clear cut, but that's not everybody. There's a lot more people that have some level of narrowing where it's not as clear to say that you could attribute the clotting partly to the narrowing at all, really, So there is a lot of, uncertainty around that.
So it's possible then that some people could have this, but they would never show symptoms necessarily.
Yeah, if someone has the narrowing but doesn't clot, they might not develop symptoms. And this is just a hard thing to understand, frankly, even for us, is that, people are all different in terms of whether or not they develop symptoms in their legs. Some of it has to do with how tight the narrowing is. Some of it has to do with, does the body get irritated and respond with inflammation to that area, And then some of it has to do with other factors that can promote swelling in the legs, or pain in the legs, So there are different factors that relate to the individual that play a role.
So, you're at a major teaching hospital, you're an expert in the field, you've been doing this for literally decades now. But for people who don't have access to the Sureshes of the world, what would you say to them in terms of, if they think they might have this, what should they be looking for?
Yeah, I think that someone that has May-Thurner syndrome, or let's just say a narrowing in that vein that is worth or important enough to be considered for treatment, really you'd want to go down that road if you've got substantial symptoms in your leg, and mainly your left leg, really. Typically, patients will have not just symptoms down in the calf, but also up in the thigh as well. Again, that's most common. And swelling, aching are typical. Some people progress to develop skin changes on their legs and things like that. But really, if they have had a blood clot and they continue to have these ongoing symptoms, then I think it is worth having it assessed.
Okay, so it does seem as though it can manifest itself in pain in certain areas, and Sarah is certainly going to speak to us about, the symptoms, signs and symptoms that she experienced. So thank you, Suresh. We're gonna now hear directly from Sarah, who does have MTS. Sarah, your story absolutely riveting. Take as much time as you need. Walk us through from start to finish. Bring us up to speed. You wrote this amazing article for today.com where you're a journalist. Share it with us. And Suresh, feel free to jump in if you have specific comments also as Sarah is sharing the story, but take us back to 2017.
Hi, yeah, thank you. And certainly feel free to jump in at any time with questions. Otherwise, I probably will ramble on. But in April of 2017, I was 49 years old, and I was suffering from, some pretty pervasive perimenopause symptoms. And so I went to my doctor, and she ended up putting me on oral hormones, the birth control pill, to kind of calm down the perimenopause symptoms. And so I went on the pill after having been off for probably a decade. And as spring rolled into summer, we were dealing with, in my family, my husband's mother had cancer, and she was very ill, and we had just lost a family member. And all of that to say, we were pretty distracted with life and the difficult things that our family was going through at that time. So I only say that to qualify a little bit, like, how did I miss the symptoms that might have been happening? I wasn't really paying attention to much else. And sadly, my mother-in-law of 30 years passed away in June, and it was the middle of June, and we were just sort of trying to pick up the pieces of the loss by July 4th of 2017. And to do so, we took our kids, we loaded them up in the car, and we drove to the beach. We're on the East Coast, so it was only like an hour drive. So we went to the beach, and we spent the 4th of July doing the kinds of beach things that everybody does. I sat in a beach chair with my feet in the water. It was a lovely day, a lovely holiday, and drove home that night, the hour-long drive, and the next morning I woke up and I had some pretty bad lower back pain in my lower left back. And, since I'd had the perimenopause symptoms, I did the whole thing that I think a lot of people, but especially women, do. I chalked it up to aging. I'm like, I'm getting old. And prior to 2017, I think it's just really important to point out that my worst medical problem had been a broken toe. So up to that point, I was a pretty healthy person and very fortunate. And I was a runner. So I really, was really trying to eat well and exercise and maybe even a slightly, if arrogant is probably the wrong word, but I think you sort of think you're untouchable or nothing's going to happen to you. I'm doing all the right things, menopause is my worst problem. So when I developed the back pain, I just thought, I was in the car. I was sitting in the beach chair. Boy, this really hurts. All the things my parents had talked about, my parents would always have back trouble when I was growing up. And I was like, it's my turn. And I really didn't think about it. I took a lot of Advil and I suffered through it. And so that was July 5th. The day after that, I woke up and the back pain was worse. Like, it was really bad. And it kind of felt like it was going down the back of my left leg as well. But still, Dr. Google told me it was sciatica. And like we all do, I just went right online, and my husband said, I really think you should go to the doctor, because I was hunched over. It was really uncomfortable. And I said, my doctor is simply just going to tell me to take Advil and ice pack my back. And I put it out. I shouldn't have sat in the terrible beach chair and all the things. And then the day after that, woke up, it was worse. And I still, again, I can't stress enough how much I completely dismissed what was happening to me. And, went on with my life. As I said,
I'm just curious, were you worried at that point, or did you just think it was sciatica?
I was zero worried. Yeah, I didn't think anything was wrong. If anything, I was angry. I'm a pretty stubborn person, and I don't like to be, if I don't feel well on any level, I'm the person who won't, crawl into bed to get better. I'll fight through it. So this to me was just, no, I wasn't worried in the least. So probably about 4 days into the back pain, I woke up, and it was like the Saturday after the 4th of July. So this is July 8th. I woke up, and it was really bad, to the point where I was like having trouble going up and down the stairs. I was limping. It had spread into my hip. And I mean, I have to say, it was pretty agonizing. And I had ice packs. I was ice packing my hip. I was trying to, take more Advil, lay down, doing all the things. And by that Saturday night, the pain was so agonizing in my lower back, in my hip, in my leg, that I couldn't sleep. I got a heating pad. I remember, I don't know how else to describe it other than to say the pain was so terrible, it was almost sickening. I felt sick with pain. But again, everybody had said, I'd heard people talk about sciatica, and I thought, oh, this is what it's all about, and this is what I have. And then finally, by that Sunday morning, July 9th of 2017, and I have to guess that anybody who's ever had a major medical event of any kind knows the date that it happened to them. And I absolutely remember the date and the time.
Yes, everybody does. We refer to them as clotiversaries in the VTE community.
Yes. Especially since even if you've never thought something was going to happen to you, you're just so ill prepared, or you don't realize it's happening to you when it is. And so that Sunday morning I woke up, and it was summer, so I had shorts on, and I remember we were supposed to take a trip to California in a couple of weeks. We were going to go on sort of like a family retreat to just regroup from everything we had gone through. And I remember saying, if I feel like this, I can't go away. I can't go anywhere. Like, I don't feel like I can move, so let alone take some sort of vacation in a couple of weeks. And it was sort of at that point that one of my daughters, looked at me and she said, "Mom, your left leg looks a lot redder than your right one." And at that exact moment, I can remember where I was standing and everything. I just felt like this terrible seizing in my left leg, unlike anything I had ever felt in my life. And I don't even know how this is related, but my lips started tingling, my hands started tingling, and I thought, am I having a stroke? But how could it be a stroke? Because it seems so focused on my left leg. And I walked around, I kept trying to stretch out what felt like somebody was pulling my muscle as tight as they could. And I couldn't get it to stop. And it was sort of at that point that my leg just began getting redder and redder, and was swelling, and I couldn't feel it. And it was just sort of like bad. Like a tumbling sensation of like everything is in forward motion, and I couldn't understand what was happening, and I couldn't stop it. So it was obvious I had to go to the hospital because we didn't know what was wrong. But we lived in the country, and the volunteer ambulance was going to take too long. So we agreed that we had to drive to an emergency room nearby.
And did you have feeling in your leg at this point, or no?
The only thing, no, I think I kind of remember, I think, like, I don't know what was wrong with me. I'm having this major medical event. I'm like, I need to get dressed and brush my teeth. I'm not going to go to the hospital in my pajamas. And my kids are crying, and my husband is freaking out, and they're trying to literally get me out to the car. And I'm like, not before I brush my teeth. So anybody listening, please don't be as stupid as I was, because I was wasting so much valuable time. But I literally pulled on a pair of jeans, and we got in the car, and started driving to the emergency room, which was maybe 10 minutes from our house. And my leg was, my jeans had holes in them, and my leg was swelling out through the holes, like literally pushing out. And I couldn't, I mean, there was just, and I have friends who are doctors and nurses, and I used to be a health editor, so they like to joke that I'm, you know, I like to play a doctor on TV, even though I'm not really one. So I knew a lot of different medical things, but this, I just could not, there was no understanding what was happening to me and
What
why.
was the swelling in your leg? Was it your entire leg, or was it more swollen in like one part of your leg?
From top to bottom.
From top to bottom.
From top to bottom, my entire leg was fully engorged, fully red, turning purple. Yeah, the entire thing, like, and swelling out of my pants, my foot, everything. And so when we got to the emergency room, they told me to have a seat and wait my turn. And I was hysterical, and I said, please, somebody needs to help me right now. Something's wrong. I don't know what it is, but I'm very worried I'm going to die. And so after, though, I got scolded by a nurse a second time to wait my turn. A doctor came out and helped me, and they put me, they got my jeans off, and they took one look at my leg, and everybody got real quiet. And next thing you know, I had oxygen up my nose and a lot of whispery voices. And, my husband was crying, and they're like, Life Star, and you're going to have, we need to transfer you. We can't help you here. The one thing they did do, though, is they put me on heparin, which at least stopped it from getting any worse. And so please jump in. Ultimately, Life Star was going to take too long because the helicopter was too far away. So they ambulanced me to Hartford Hospital in Connecticut, where I was fortunate enough to have a doctor working that weekend who knew what was wrong with me. And they did an ultrasound, and my leg was literally clotted from my ankle all the way up to my abdomen. And with nowhere to go, the blood had just begun filling up all the tissue in my leg. And so they put, again, they put me on clot busting drugs. They put a stent in the back of my leg, or a catheter, I should say. And I spent a couple of days in the ICU, and then they went in to see if the clot had been broken. And I'm among the lucky. They had managed to break the clot up, and they inserted a stent into my abdomen, which I have and shows up on all my x-rays.
Did they give you something separately for the pain when you first arrived?
That's a great question. And I have to be honest, I don't remember. I think my overriding thing in that moment, honestly, and I'm not trying to sound altruistic or anything, but my husband we just lost his mom, and all I could think of was, please don't let me die now, because that can't happen to my family. Like, that was, so everything else was secondary to the please don't let me die. That's all I can think of.
Understandable. Yeah.
So it's really a blur. I'm sure like anybody on this call who's ever had an event like that, it's just everything is in flashbacks of like surrealness. I can't believe this happened to me.
I'm wondering if, and Suresh, maybe you can comment on this, that this is mistaken for sciatica initially.
Yeah, I mean, it can be. And, I think that, I think there's a couple things. One is that, you're somewhat harsh on yourself, because I think, I'll tell you, even healthcare providers that develop symptoms, wait and wait and wait before going in or getting help or asking somebody for guidance or whatever it is. That's just human nature to some extent. But in terms of what the symptoms can mimic and all that, yeah, sciatica is a common one. And when you get with May-Thurner syndrome and an iliofemoral DVT, where the clot is up high in the iliac vein, you get clot out into the pelvic veins. And that it can irritate the nerves. So there can be actual, kind of something like sciatica that really does result in the same nerves. But sciatica is such a common issue as well, right? That it's the first thing that people think about as well, especially if you go online and the pain's going down the back of the leg, that's what's going to come up probably, right? But I think if you have the swelling, the discoloration, things like that might tip you off if you happen to have heard about these things, but many or most people haven't necessarily, right?
So Suresh, Sarah mentioned that, so she was given clot busting medication, right? Can you, for the folks out there that aren't familiar with how that works, can you explain how clot busting medications actually work and
Sure.
help the patient?
Yeah. So first I'll mention that we want to distinguish blood thinning drugs, which is the colloquial term for anticoagulation drugs, right? And those drugs are the standard care for blood clots, and they prevent clots from extending, but they don't necessarily actively break down clots.
Right.
So now when we talk about the clot dissolving drugs or the clot busting drugs that you're talking about, those drugs actually cleave clot. They cleave fibrin, which is a protein in clot, and they really break the clot down more actively. Now, the downside of those medications is that because they're so powerful, they can also cause bleeding in the body. And so as a result, they're not something that we use in everybody. But when the clot is very extensive like this, there are patients that really do need something additional even beyond the regular blood thinning drugs. So what we do is that typically these days we insert a catheter, which is almost like a long noodle with holes in it, like a garden hose almost, but small, into the vein, into the blood clot under imaging guidance. And then we infuse the clot busting drug into the clot and really bathe the clot with it and break it down that way. And sometimes we have catheter mounted devices that can also chew up clot a bit. And then we just try and eliminate as much of the clot as we can. And then we examine the vein under it by, again, doing imaging and injecting X-ray dye and looking at it to see, is the clot gone? How much clot is left? And then is there a narrowing in the vein that is limiting blood flow? And if there is, then that can also be treated either by ballooning up the vein or by putting a stent in place.
So Sarah, for amazing story, and thank you for sharing.
Oh, we're not done yet with Sarah's story, so.
But I just want to ask you,
two.
did this help you? Do you think about your health differently now? Now that happened, do you prioritize? I mean, do you feel like you're more aware of things, and it's kind of changed how you respond to anything that's changing in your body? Has it just changed for you?
Oh, 100%. And I think it's important to say too that the whole reason I even had mentioned having gone on hormones like 3 months prior to this happening is that I was born with May-Thurner. I have the congenital defect of the veins crossing, but it was because I had gone back on hormones, which end up thickening your blood. And because my blood had thickened enough, it could no longer get through my veins. And so I think it's really important, I had read warnings about, the pill or whatever. And again, I think you always think it applies to somebody else and not you. So from that standpoint, I think it was a game changer in understanding that, anybody at any time can be one of those odds. And unfortunately, I was one of them. Unfortunately, I came across, I had the good fortune of having a physician who knew what I had right away. Right. And I know a lot of people don't have that or get sent home, or people, lose their leg because they aren't correctly diagnosed. So on all fronts, yes, I feel like dramatically, I feel very, very vulnerable after this, and but also really grateful that I was able to have a vascular doctor on call that day who knew what I had.
So lucky. I mean, wow, so lucky. So you're in the hospital. Tell us what happens. They've diagnosed you now, I'm assuming. And what happens next?
What happens next? They did. So I did have to, undergo, I guess, a procedure to have that catheter inserted up the back of my leg. And then I did spend a couple of days in the ICU while they delivered as we were just talking about the clot busting medication. And then, yes, they inserted the stent, and I think I stayed another couple of days. And I was able to go home. But it was, on blood thinners for a long time after that. I had to wear, compression hose on that leg for many, many months. And I still go back for annual visits and ultrasounds. And when I fly any long distance, kind of anything, I do have an injectable blood thinner that I have to use just to make sure that nothing like this happens again. And I also, they sent me to have the testing done for the blood clotting marker, the Leiden factor, because my father has it. And I did test positive for it, but I have it only recessively. So it's supposedly, from what I understand, this is really not my area of expertise, but because it's recessive, I shouldn't experience any further clotting, but I'm, I take precautions every day to make sure that it doesn't happen in that leg or anywhere else for that matter.
Yeah, and I'm sure you keep a very close eye on it. Suresh, can you comment on the role of compression socks and how they get used and what they do for people?
Yeah, so compression stockings are actually, I think, very helpful in reducing swelling in particular. And there have been studies that demonstrate that they also, the effect of them also reduces inflammation within the leg, and that kind of promotes good venous physiology. Now, compression stockings have been evaluated in clinical trials to see if they prevent the long-term complications of blood clotting, so post-thrombotic syndrome. And the clinical trials have kind of gone both ways, but the best trials don't suggest that they actually prevent the long-term problem. But in terms of managing your life on a daily basis, when you've got swelling in your leg, most people that use compression stockings find them to be helpful. It does take a little bit of tweaking around, though, I think, and a little bit of patience to really find the stocking that can work for a particular patient. Sometimes they feel very tight, or maybe if they're not sized properly, they can be difficult to kind of deal with. So it does take a little bit of patience to figure out what will work, but usually something can be made to work, and that can be helpful.
Do you recommend that people talk to their provider or talk to a vascular specialist, talk to somebody before they go out and buy their own compression?
I do, because there are different types of stockings, and it's gotten even more complicated now because now online you can buy all kinds of things, right?
Right.
But the bottom line is that the traditional TED hose or stockings are at a very low pressure that don't really do a whole lot.
Right.
The medical grade prescription stockings do a lot more, and they've been designed to have more pressure where that's needed. Now, the downside is that they are more costly, though, as well. And insurance often doesn't pay for it. And so I think though online there are products that you can get a little bit discounted, but you want to make sure that they really do have that ankle pressure that's favorable.
Yeah.
Good point. Wow. I mean, Sarah, that was an amazing story. When I first read your story, I felt like I was there with you. You just draw people into the story. So thank you for sharing that with us. Todd?
One thing I just wanted to ask, I'm just curious, what anticoagulant were you put on when you went home that you had to be on for 3 months?
I think it was a bit longer than that. And gosh, I feel like you've definitely just stumped me. I don't mean it's one of the Xarelto. Is it Xarelto?
Might be Xarelto.
Yeah,
That's what I'm on. Yeah.
Yes, I was on Xarelto. And I just wanted to throw back in as far as the compression stockings go. To your point, I went and I got my first one, and it was just a single compression stocking that went up my thigh on my left leg. And I have to say, I thought if I have to wear this for the next 6 months, I'm not going to make it because it was so painful. It literally was bruising my leg. It was so tight and uncomfortable. And what my surgeon ended up recommending was just getting the pantyhose. And so I did wear the compression hose on both legs for 6 months. And that was, it wasn't, it was summer, so it definitely was a hot way to go, but
Right.
well worth it to kind of get things back to where they were before the event.
Do you have any residual pain today? Do you have any discomfort that pops up now and then?
So here's the funny answer. Yes. And the way Dr. Shaw, my vascular surgeon, described it is because the blood clot filled up my entire, it filled my entire vein, and it stretched it out. And so the word he used is, I'm really sorry to say this, but it's going to be flabby from this point forward. So, and because of that, it can be very achy. And at certain times I do notice that it does, it's just a residual ache. And in fact, not to drag this on and put everybody to sleep, but right around the time I just wrote this story in March, I live here in New York City, and I was walking home from work, and my left foot started hurting, and it was hurting a lot. And I came home, and my husband and my daughter, who live here with me, I took off my sock, and my left foot was red and swollen, and everybody freaked out. And I had contacted my doctor, and I had to go to the emergency room to make sure that because I sit a lot for my job, and they worried the stent had failed. And as it would have turned out, I broke my foot.
Oh, wow.
I know, but it was so similar to what my leg looked like, just at least foot wise, to the 2017 thing that we thought it was happening all over again. So on top of, yes, there's like residual discomfort now and again. I think like when you break or hurt anything, I think you sort of will always have issues of inflammation from there on out. But also, I think there's the residual discomfort of, when is this going to happen again? You sort of wait for the other shoe to drop, even though chances are pretty slim now that I have a stent.
Well, amazing story, amazing experience. And I think, I kind of share this one feeling with you, which is, I think you put a positive spin on it, which is what I do with my blood clotting experience, because you're able to share this information with people and you're helping somebody, and that's kind of the blessing. I think it's a blessing that comes out of all of this, because we can help somebody else. So I just want to thank you for sharing your story and your information, and definitely chime in with anything else that you want to say. But Suresh, do you have any comments on Sarah's story? Anything that comes to mind that you want to comment on? And I think we touched on this a little bit, but why is this it's misdiagnosed so often, or it's not caught?
Yeah.
Why is that? What can we do to not make that happen again?
Yeah, it's a tough one. I think that primary care providers that see so many conditions and diseases, they can identify a blood clot, and most of the time that they'll do in a timely fashion nowadays. Although even that, as you know, has been a challenge, right?
Yes.
Sometimes, right?
Yeah,
I mean, and but then when you start to think about May-Thurner, it does require having heard about it, in particular, knowing the scenario in which it's seen in. I do think that over the last 10, 15 years, there's more of it in medical literature, for example, and more of it in textbooks and all that. And so I do seem to notice that more providers, when you say the term, have some awareness of it, but by no means is it, ubiquitous or universally known. So we have a lot to do on the education side, frankly.
Yeah. Leslie, did you want to take some questions from what the audience has submitted, or do you have something else?
So just a kind of a continuation on this. So Suresh and Sarah, it seems that some MTS patients actually get post-thrombotic syndrome. Sarah, it doesn't sound like you actually experienced that. Sounds like you had from a horrific experience, snapped back pretty well, thank goodness. Suresh, how common is PTS in May-Thurner? And is it with people, is it with blood clotting overall, or is it specific to May-Thurner? I know you've done a lot of work in this area, and you have a trial going on now. Can you share what PTS is with the audience, and what the goal of the trial is? And also, how could a patient enroll if they chose to?
Sure. Thank you. After you are treated with the blood clot up front, typically people are treated with blood thinning drugs. You hope that the clot regresses and kind of goes away, but more often than not, especially with a larger blood clot, some amount of the clot remains in the vein, and it changes in its character, but at the end of the day, some of it stays in the vein and causes partial or complete blockage of the veins in the leg and the pelvis.
Mhm.
In addition, you get that inflammation, and sometimes that causes damage to the one-way valves that work in the vein. And the combination of those things elevates the pressure in the venous system in the long run. So when a person is upright and they're walking or doing things, typically they get leg aching, swelling, heaviness, fatigue. And then some people even progress to where that congestion results in changes to the skin. And then a smaller percentage, maybe 5 or 10%, actually develop open sores on the leg where the skin actually breaks down. So that overall syndrome, which can vary, some people have it mild, they have a little bit of ankle swelling at the end of the day and they're able to live their lives. Other people have it much more significantly to where it really limits their activity quite a lot, and they can't work very well and they can't really do their usual daily activities. Overall, in a person with a leg blood clot, maybe about 40% will develop some amount of post-thrombotic syndrome. The larger the blood clot, though, the more likely it is to occur. And in people that have the iliofemoral deep vein thrombosis that accompanies May-Thurner syndrome, it's probably more like 50 or 60% will end up getting post-thrombotic syndrome. And it tends to be a little more severe than patients that don't have it, So the larger blood clots, more post-thrombotic syndrome and more severe. So, once post-thrombotic syndrome has already developed, it's not an easy condition to treat. And there are many people that really are just living with, in their daily lives, they're just having to contend with this problem that can be very life-limiting for many of them. You can try using compression stockings to reduce the swelling. You can try using, there are some kind of anti-inflammatory type supplements that can be used sometimes they help some patients, but we don't really have a solid solution that really works for all patients or most patients, So right now, one possibility is that, we've noticed that people who have more blockage of their veins tend to have more in the way of symptoms of their post-thrombotic syndrome. And so one thing that we're evaluating in this clinical trial called C-Tract now is the use of stents to prop open blocked iliac veins and restore blood flow and reduce the venous pressures, and in the hope that will reduce patients' symptoms with their post-thrombotic syndrome. So patients who have had a blood clot more than 3 months previously and continue to have symptoms in their leg that really affect their lives substantially may be eligible for this study. And, ultimately before being enrolled, we would have to confirm that they really do have some level of blockage of their iliac vein and that they don't meet some of the other, safety focused exclusion criteria. But the bottom line is that those are the people that we're trying to enroll.
And so would they see an interventional radiologist, or who would they actually be interacting with in that medical situation?
Yeah, in the trial, we have study centers across the country that have teams of doctors that have diverse kind of expertise. So they typically match a medical clotting expert, like a hematologist, for example, with either an interventional radiologist or a vascular surgeon. And so they have kind of the benefit of different kinds of expertise. And so that's how our study teams are constituted. I think in people that have post-thrombotic syndrome, I think it is advisable, and I think it is a good thing to go and seek out either an interventional radiologist or a vascular specialist of some kind, whether it's a surgeon or a vascular medicine doctor, because I think those physicians are just a little more knowledgeable about the condition than most other physicians are, and can help them kind of get focused treatment for it.
Okay, great. So we have a gazillion questions, and we're going to try to get to some of these questions. Thank you very much, everybody, for all these questions that came in. We just want to preface this by saying we are not giving you medical advice here tonight. We are, and by the way, the lights have gone out in my office if you're wondering why it's so dark, because it's on a timer. But we are not giving medical advice. Please, this does not, replace you speaking directly to your doctor, your healthcare provider. This is for educational purposes, and we want to give you the educational information to help you as you move forward. So we actually had a question from somebody who, and I feel your pain with this one. So she was told, this is from Sarah, she was told not to pursue May-Thurner by a vascular specialist. On top of the doctors in the ER refusing to attempt to break up or remove the clot. Does a list of facilities that specialize in MTS and its treatment exist? She lives on the western side of Virginia, and she's looking for, what type of doctor, who she should be going to get a specialist.
Yeah. So there isn't probably a list that's kind of focused on May-Thurner syndrome. I mean, I can tell you that in Virginia, the University of Virginia definitely has doctors there that are very well versed in this particular condition, and there are others out there as well. But one thing to keep in mind is that, again, everyone doesn't need to get their clot dissolved actively. Now a lot of people with May-Thurner syndrome would benefit from that, but having said that, everyone doesn't need to. And also, if someone has a narrowing in the vein, if they're not really having a lot in the way of symptoms, then in that situation also, we often would suggest trying other things, because a stent at the end of the day is a kind of a permanent device. It's going to be in there forever, right? And so before biting the bullet and doing something like that, if the condition can be managed otherwise, that would be optimal, but that's not always the case, right? So the main thing is just to get evaluated and make sure that person really is kind of familiar with post-thrombotic syndrome and familiar with May-Thurner syndrome.
Okay, and we had somebody write in and say that they were trying to avoid stents because of their age, but that actually didn't work out for them. Is there any influence of age on getting a stent? Do you try, either if they're younger, try to not use them, or if they're older, do they not work as well? Is there any age difference?
We tend to be a little bit more careful in people who are younger, just because they have a longer life expectancy. And we can talk about, we've been putting stents into veins for maybe 25 years now, but there aren't many really good long-term studies. We do know that some stents over time either get narrow or blocked up. And then, at the end of the day, it's a permanent device, and there's always the unknown out there as well, right? So it's good to be prudent. Now, that having said that, if someone really is not able to have a good quality of life because they've got their leg is so swollen, or they have so much leg pain, or whatever it is, then there are reasons to do this, right? And so we definitely wouldn't want to dismiss it, but I think we tend to be a little bit more careful the longer your life expectancy is, just because there are more unknowns, about the stents in the long run.
Okay.
Sure. Hey,
Yeah.
Suresh, so you mentioned anti-inflammatory a couple of times, and we've received a couple of questions, and I get this all the time in the support group. People just can't go out and start taking Advil or Aleve on their own. Can you tell us why? Because so many people want to know, why would taking something like that, how does that affect the anticoagulant itself? What are the dangers, and what are the other options that are available for them?
No, it's a great question. The typical kind of what we call non-steroidal anti-inflammatory medications, like the ones that you mentioned, ibuprofen, for example, is the kind of the classic one. Those medications, they have a small effect on that can increase bleeding risk, via their kind of biological mechanism. And so when they're given along with blood thinning drugs, there is a slight added risk of bleeding. It's not large, but certainly, if there's not a good reason to be on them for the long run, on an ongoing basis, it's nicer to avoid them. And people that have issues with their kidneys, it's better to avoid those medications if possible. Now, that doesn't mean that if someone, for short-term use for a few days here and there, I don't worry about that at all, really. Now,
Right.
But the anti-inflammatories that I was talking about are a little bit different. There are kind of supplements that really have active ingredients in them that seem to reduce kind of venous inflammation, so they're different than these other kinds of drugs that we're talking about
Sure.
here. And these medications, they're not as well tested. There's one of them that's been approved as a medical food in the US by the FDA. But and some of these other medications have been tested in Europe and other places, and seem to show some effects. In our clinical practice, we do use them, and I do find that some patients do seem to benefit. Everyone doesn't benefit, so I usually will try them for a few weeks, and then if they're not getting any benefit, I just stop them.
Sure.
But there are these medications that can be helpful in people that have post-thrombotic syndrome.
Yeah, my orthopedics trauma surgeon and my hematologist got together, and they actually put me on, said I could take a leave, but it was on a very strict protocol, right? It was 2 or 3 days and then nothing for 4 days, and then 2 or 3 days again. And that seemed to work really well for me. While we're on that, another question was, what about baby aspirin? Can you just talk a little bit? Why do so many doctors put their patients on baby aspirin, not only with the anticoagulant, what's the relation there, but just as baby aspirin by itself, does that help? Is there a certain type of clot that helps prevent? What's your thoughts?
Yeah, so aspirin is quite a large story, but in this area, blood thinning drugs, the typical anticoagulants work via affecting kind of your clotting cascade, as we call it. Aspirin works by affecting platelet activity, which is another blood component. And so they kind of have complementary mechanisms, right? Aspirin, when you give it at the baby aspirin dose, it has almost the same effect as the full dose, but the risk of bleeding, the additional bleeding risk is much lower, so it's a much safer actually, most patients don't necessarily need to take aspirin along with their blood thinning drug if they just have a blood clot, for example, a DVT. But for example, if they have a stent in place, it's nicer, at least for a few months, to add an antiplatelet agent while the stent is still being lined, And then there are, of course, patients that have there are other reasons to give aspirin, for example, to prevent heart attacks and things like that, in people that have risk factors there, especially as they get older, So as a result, a lot of people tend to be on these medications.
Sure. Okay, thank you. Leslie?
Yeah, so here's another great question from, I think I'm pronouncing her name correctly, Jana. I am also younger, and they had to place a stent after being initially conservative, but my iliac vein collapsed after the clots were removed. From what you have seen as a MTS specialist, is there any harm in high-level activity long-term to the stent? My doctors have given me clearance, but like you mentioned, there isn't long-term research of stents in younger people.
Yeah, no, I would not be worried about that. I mean, I think that you can pretty much go about. I mean, the only provision is that in the first few weeks after we place the stent, we like to have it kind of grow into the vein wall before we sort of say pursue your heavy lifting routine kind of thing, But in terms of being active after stent placement beyond several weeks, really you can pretty much have at it. There shouldn't be really much reason for worry at that point.
Oh, that's great. Okay.
Yeah.
Also, how do you determine moderate PTS? Somebody was reading through the requirements for the study. I was a marathon runner. I ran a 10K this past weekend. Congratulations. After working up to it again since diagnosis in December. My leg has been painful again since Saturday with only walking and regular activity. Pain is normally a 2 to 3. Excuse me. After a push 4 to 5 and thighs tight again for a few days.
Mm-hmm. Yeah, so there are of course measurement scales, things like that, but to me I look at it from the perspective of life impact, I think that when you start getting into things like marathon running and being high level athletics and all that, the importance of that to an individual person can vary quite a lot, right? Overall, the sort of conservative way to look at it is to say, well, we're talking about perhaps putting a permanent device into you, right? If you're not having much in the way of symptoms with regular activity, is it really worth it to do that? But then again, I myself have some patients for whom their high performance activities are very meaningful and important to who they are, right? And in that kind of situation, I really try and have an individual discussion about this and talk about, okay, I want you to go into things very clear-headed about what we're talking about here, because we're going to have additional discussions later down the line, and it'll be very different then, right? So it's nicer to talk about these things up front, just so you know what you're getting into, right? So I don't say absolute no, but then again, I do think that it's wise to try and think about the long run. It's not easy. I tell you, when you're young and active, I remember, Sarah, when you were talking earlier about, about feeling like I kind of felt like I was, on top of the world or wherever it was. I mean, I have so many patients that the most challenging discussions I have are with my younger patients, because when you're young, you expect to feel normal. I mean, it's just, as I'm in my 50s now, and so I'm starting to finally grudgingly accept the fact that everything just can't be the way it was, before. But when you're younger, you don't accept that. And even maybe for people, there probably are marathon runners in their 50s that also don't accept that, right?
Right.
But so I think it's very individual, and I think it's just a matter of having that discussion about how symptomatic are you, how much does that affect what you're trying to do, and how meaningful is that to you?
Sarah, are you back to running? Was there any discussion about exercise post your May-Thurner event?
They didn't want me to, I couldn't start running again right away, no, but they did want me to be walking pretty much right away from the time I got home from the hospital. And I took the direction well, and I tried to, I just wanted to get back to myself. So yeah, post May-Thurner, unfortunately, as we were just talking about, I am in my mid 50s now, and everything else is going wrong. So running doesn't seem to be in my near future anymore, but not, I don't think, because of May-Thurner. But that said, other than, as we talked about just a little bit earlier, some residual, I do get achy, and it's not quite the same, but in terms of limitations or feeling like I couldn't go back to my normal activities or the amount of physical activity I was doing, again, I was really, really lucky among the people who have this, that I was able to resume everything almost, pretty much normally.
For sure. Okay. All right. So we want to be mindful of time. And we have actually gone past the 8 o'clock hour, because this has been incredibly interesting. I think, Todd, you're going to have some more poll questions. So I'm going to turn it over to you before you turn it back to me for the close.
Yeah, we don't want to say goodbye quite yet, folks. We want you to participate in a second poll, so we'd really appreciate if you just give this a little bit of time. Up on your screen, after today's webinar, what is your knowledge about MTS? No knowledge, some knowledge, very knowledgeable now. And the last question after today's webinar, what is your knowledge about the signs and symptoms of blood clots? No knowledge, some knowledge, very knowledgeable. If you could just answer those two questions real quick, we'll go ahead and read the results. And then I'll be sending it back to Leslie so we can close out with our guests, who we've been very lucky to have, by the way. I thought this was extremely informative. Close out of mine here, and we'll see if we get the results to pop up from those questions.
Yeah, this is really interesting.
Yep, and here we go. So our first question after today's webinar, what is your knowledge about MTS? No knowledge, 0%, some knowledge, 47%, and now 53% say that they're very knowledgeable. So a lot of people did learn something at this pep talk, so great. After today's webinar, what is your knowledge about the signs and symptoms of blood clots? No knowledge, 0%, some knowledge, 21%, and 79% very knowledgeable. So that's very promising and very, very excellent statistics.
Actually, that's amazing. I think we need to take Sarah and Suresh on the road to educate people.
Let's do it.
Or Sarah, I don't know, a Today Show event with Suresh, you guys can educate the public on this one. But listen, this was fantastic, and we want to thank both of you tonight for attending. I know I learned a tremendous amount tonight. Before we sign off, we're going to give the final word to Sarah. And Sarah, what would you like to share with the audience about your experience?
You know what? Thank you for tossing it back to me, because what I really wanted to say, and I didn't get to say, is that after all this was said and done, I went back to my primary care physician for a regular checkup. And he looked at my chart, and I told him everything that happened. And he said, you have what? And I said, I have May-Thurner syndrome. And he's like, I've never heard of it. And he Googled it. And like, he literally had no idea, which I think, is something it's really important to educate people on this, because I think it is really rare and a lot of people don't know what it is. And I did, the last thing I will say about that is I said, so for my husband's encouragement, I go to the doctor and I come see you. If I had come to you and said, my back really hurts, my leg is in pain, I said, what would you have done? And he said, I would have told you to go home and take Advil and ice your back. So I think that is, I really think it's important to say that to anybody listening, or anybody who ever has anything, do a gut check. If you think something is wrong, it's, I know it's cliche to say, but never ignore it. Really, you should never ignore it.
100%.
Wise
All right.
words.
Well, thank you both, and good health to everybody. And we'll see you soon for the next PEP. Good night, everyone.
Thanks a lot. Bye-bye.
Thank you.
Thank you.
Best of luck, Sarah.
Thank you. Thank you so much.
Good night.